Imagine this. A completely normal morning, someone is talking, laughing, maybe even drinking coffee. And suddenly their face drops slightly on one side, their words start to blur, and their hand just stops responding. It feels confusing, almost unreal, like something small that will pass in a minute. But here is the truth that most people do not realize. According to the World Stroke Organization, every second during a stroke, the brain loses about 1.9 million neurons. Yes, million. Not thousands, not hundreds. And this damage is happening silently, rapidly, and often without pain. If you find this helpful, take a second to like this video, because one simple click might help this life-saving information reach someone who needs it in time. What makes stroke especially dangerous is not just how severe it is, but how ordinary it can look at the beginning. Many people delay action because they think maybe they're just tired. Maybe their blood pressure is a bit high. Maybe they just need to rest. But stroke does not wait. It does not slow down. And the longer the brain is deprived of oxygen, the more irreversible the damage becomes. Here is the gentle but powerful insight. Stroke is not a dramatic event that announces itself loudly. It often whispers first. A slight slur, a tiny imbalance, a subtle weakness. And recognizing that whisper, that is where lives are saved. A stroke is not just a sudden health event. It is a process where the brain is being starved of oxygen or damaged by bleeding. There are two main types. Ischemic stroke, which accounts for about 85% of all cases and happens when a blood clot blocks a vessel, and hemorrhagic stroke, which occurs when a blood vessel ruptures and causes bleeding in the brain. According to the American Stroke Association, both types disrupt the brain's ability to function, but they require very different treatments, which is why acting fast and getting the right diagnosis is critical. Here is something that changes how you see stroke forever. The brain does not have a backup system. Unlike muscles or skin, brain cells cannot regenerate once they die. Research published in the journal Stroke shows that in a large vessel ischemic stroke, the brain ages about 3.6 years for every hour without treatment. That means even a short delay can translate into long-term disability, loss of speech, or paralysis. Many people imagine stroke as something dramatic and obvious, but medically, it is more like a sudden interruption in a delicate supply chain. Blood carries oxygen and glucose, and without that steady flow, brain cells begin to shut down within minutes. Some areas may be temporarily salvageable, but only if blood flow is restored quickly. The key insight here is simple but powerful. Stroke is not just about what happens. It is about how quickly you respond to what happens. Minutes are not just time. They are brain function, memory, movement, and independence. There is a simple tool that can help almost anyone recognize a stroke within seconds, and it is called FAST. Medical organizations like the American Stroke Association promote this rule because it is quick, memorable, and highly effective in real-life situations. Studies have shown that public awareness of FAST significantly increases the chances of early hospital arrival, which directly improves survival and recovery outcomes. FAST stands for face, arm, speech, and time. Face means asking the person to smile and checking if one side droops. Arm means asking them to raise both arms and seeing if one drifts downward or feels weak. Speech means listening carefully for slurred or strange speech. Even subtle changes matter. And time means that if any of these signs are present, you must act immediately and call emergency services. Here's the insight most people miss. You do not need medical training to save a life. You just need to notice what is different. A slightly uneven smile, a slower response, a sentence that does not sound quite right. These are not small details. They are early warning signals from the brain. Research suggests that patients who arrive at the hospital within the first few hours are significantly more likely to receive clot-dissolving treatment and regain independence. So recognizing FAST is not just about awareness. It is about giving someone a real chance to walk, speak, and live normally again. Not every stroke announces itself clearly. In fact, according to research from the National Institute of Neurological Disorders and Stroke, a significant number of patients experience mild or unusual symptoms before a major stroke, but these signs are often ignored. This is where many critical minutes are lost, not because people do not care, but because the symptoms feel too small to be dangerous. Now, here is something important to remember. Not all strokes look like the FAST checklist. Some begin with sudden dizziness, a brief loss of balance, or a strange sense that the room is spinning. Others may notice blurred vision in one eye, or a sudden severe headache that feels different from anything they have experienced before. These symptoms can come and go, which makes them even more confusing and easy to dismiss. If this is helping you see stroke in a new way, take a moment to comment below, because your experience or awareness might help someone else recognize these signs earlier. One of the most overlooked conditions is a transient ischemic attack, often called a mini-stroke. Studies show that up to 1 in 3 people who experience this will go on to have a full stroke, often within days if no action is taken. The symptoms may disappear quickly, but the risk does not. The key insight here is gentle but powerful. Your body sometimes whispers before it screams. And those quiet signals, dizziness, vision changes, unusual headaches, are not inconveniences. They are early warnings giving you a narrow but valuable window to act. When a stroke happens, what people do in the first few minutes can either protect the brain or cause even more damage. Unfortunately, many common reactions are based on habit or cultural beliefs rather than medical evidence. According to the American Stroke Association, delays caused by incorrect first aid actions are one of the major reasons patients miss the critical treatment window. One of the most harmful mistakes is waiting. People often think, let us see if it improves. Maybe it is just fatigue or high blood pressure. But as we mentioned earlier, nearly 2 million brain cells are lost every minute during a stroke. Waiting even 30 minutes can mean a significant loss of brain function. Another common mistake is giving food, water, or medication. During a stroke, the ability to swallow may be impaired, even if it is not obvious. This can lead to choking or aspiration, which can quickly become life-threatening. Giving aspirin without knowing the type of stroke can also be dangerous, especially if it is a hemorrhagic stroke, where bleeding is already happening in the brain. In some cultures, practices like scraping the skin or pricking fingers are believed to help, but there is no scientific evidence supporting these methods. In fact, they waste precious time that should be used to get the patient to a hospital. The key insight here is simple and critical. The best help you can give is not doing more. It is doing the right thing quickly. Call emergency services immediately and get professional care as fast as possible. In stroke care, there is a phrase doctors repeat again and again: time is brain. This is not just a metaphor. It is a measurable reality. Research published in the journal Stroke shows that for every minute a large vessel stroke goes untreated, the brain loses approximately 1.9 million neurons, and the patient ages neurologically by several days. This is why every second truly matters. There is what doctors call a golden window, typically within the first 3 to 4.5 hours from the onset of symptoms. During this time, patients with ischemic stroke may receive a clot-dissolving treatment known as TPA. According to clinical studies, patients treated within this window are significantly more likely to recover with little or no disability compared to those treated later. In some cases, advanced procedures like mechanical thrombectomy can extend the window up to 24 hours, but only for carefully selected patients and only in specialized hospitals. Here is the part that surprises many people. The clock does not start when you arrive at the hospital. It starts the moment the first symptom appears. That means every delay at home, every moment of uncertainty, directly reduces the chance of recovery. The insight here is both urgent and empowering. You do not need to treat the stroke yourself. You just need to act fast enough so that doctors still can. The faster the response, the more brain can be saved, and the more of that person's life can be preserved. Many people believe that stroke only happens to older adults, but recent data tells a different story. According to the World Stroke Organization, about 1 in 4 adults over the age of 25 will experience a stroke in their lifetime. Even more surprising, studies have shown an increasing trend of stroke occurring in younger adults, particularly those under 50. This shift is closely linked to modern lifestyle factors rather than age alone. Conditions like high blood pressure, diabetes, obesity, and high cholesterol remain the leading risk factors. The World Health Organization estimates that hypertension alone contributes to nearly half of all stroke cases worldwide. But beyond these, there are quieter contributors that many people overlook. Chronic stress, poor sleep, long hours of sitting, and diets high in processed foods. These factors slowly damage blood vessels over time, often without noticeable symptoms. Young professionals, especially those working in high-pressure environments, may feel healthy on the surface, but internally, their metabolic health may be under strain. Long periods of inactivity combined with irregular eating and sleep patterns create a perfect storm for vascular problems. The key insight here is gentle but eye-opening. Stroke risk is not defined by age. It is shaped by daily habits, and the earlier those habits are adjusted, the more powerful the protection becomes. Small, consistent changes, like managing blood pressure, improving sleep, and moving more throughout the day can significantly reduce the risk long before any warning signs appear. When it comes to stroke, the most powerful actions are often the simplest ones. You do not need medical training, expensive tools, or perfect conditions. You just need awareness and the willingness to act. According to global stroke data, early recognition and rapid response can dramatically improve survival and reduce long-term disability, sometimes making the difference between full recovery and permanent impairment. Before we go further, if you want more simple and practical health insights like this, take a moment to subscribe to the channel, because the more you understand your body, the more control you have over your future. The first action is to remember fast and actually use it. In a real situation, do not second-guess yourself. If something feels off, check the face, the arms, and the speech immediately. The second action is to call emergency services right away. Do not wait. Do not search online. Do not try home remedies. Let trained professionals take over as quickly as possible. The third action is to note the exact time symptoms started. This small detail can guide doctors in choosing the safest and most effective treatment. Here is the final insight to carry with you. Stroke is unpredictable, but your response does not have to be. In a moment of uncertainty, clear and simple actions can protect the brain, preserve independence, and even save a life.